So good afternoon. I'm going to start with the daily update. Yesterday, the Department of Public Health reported about 13,000 new molecular tests were given to new individuals. 367 of those returned as new positive cases. The Commonwealth continues to be a national leader in testing more people per capita per day than any other state in the country. The total number of molecular tests conducted is fast approaching 4 million here in Massachusetts, and over 2.2 million individual people have received at least one molecular test. That's almost 1 in 3 residents of the Commonwealth. The 7-day average for the statewide positive test rate has been at 0.9% for the past 4 consecutive days. That's one of the lowest positive test rates in the U.S. 418 patients are currently hospitalized, many of whom are actually not hospitalized to be treated for COVID, and 85 are in the ICU. Massachusetts publishes more data about the pandemic than most states and has an A+ from the COVID Tracking Project. It's important to remember that today's order applies only to lower risk communities. Communities that have been designated as red in any of the 3 most recent weekly DPH reports are not permitted to move forward in the reopening process until the data indicates it is safe to do so. That's interesting. That page is totally out of order. We'll figure out where that one goes. So I just stepped on my own lead. This includes a COVID risk map that shows infection rates by population for each city and town, and the map contains over half of our 351 communities currently have extremely low case numbers or have not seen any cases for a couple of months now. Our hospitals have more than adequate capacity to properly care for COVID-19 patients and other patients needing medical attention. And I'd like to note that for the past several days, the Department of Public Health has been recording a slight increase in new positive cases. Public health experts have said for a while that cooler weather and increased activity in the fall could lead to more cases. Here in Massachusetts, for example, we've seen thousands of college students and faculty and staff return to college campuses. By partnering with the Broad Institute, many of our colleges are running some of the most aggressive student, faculty, and staff testing programs in the country. We want to see more testing coming online because that's how we identify and stop the spread of COVID quickly. But more testing, especially in high-risk communities through our Stop the Spread campaign, does lead to more positive tests in the statewide data. We've also learned of several large informal gatherings in different communities statewide that have caused viral transmission. While we've seen more cases, the most significant trend so far is attached to informal gatherings and celebrations. As always, DPH will continue to vigilantly monitor data and will continue our aggressive contact tracing efforts. We'll also continue to evaluate the public health data in the event that changes to our reopening strategy become necessary. Overall, we've seen significant progress statewide in our effort to contain COVID-19. According to our public health data, the 7-day average percent of positive COVID tests has remained below 1% for 35 days in a row. That means that most communities have been successful in stopping the spread of the virus by making changes to their daily behavior. Wearing face coverings, practicing social distancing, and following industry and organization-specific safety guidance have all played a role in containing COVID. But we know there are still several communities where COVID is spreading at a high rate. In August, our administration began publishing and tracking COVID-19 cases at the municipal level to better understand which communities are still seeing a high number of cases by population. This data, which is published weekly, has been informative for residents and local officials and public officials who need to take additional public health precautions and have also allowed people to identify better the sources of new cases. We've also launched our Community Enforcement and Intervention Team to assist public messaging campaigns and enforcement teams to ensure people and businesses are following the appropriate guidelines to stop the spread in high-risk communities. The Commonwealth's come a long way to allow the reopening of most industries and activities, and most importantly, continue to focus on getting kids back to school. In addition to over $1 billion in additional funding for local governments and school districts, the Department of Elementary and Secondary Education provided districts with highly detailed plans to bring students back to the classroom. These plans have the backing of medical professionals from around the Commonwealth and, most importantly, the Mass Academy of Pediatrics. Educators are stepping up every day in communities across the Commonwealth to bring kids back, and we continue to urge communities that have no COVID or low rates of COVID, like the hundreds of gray and green communities we have here in Massachusetts, to pursue these models. In the beginning days of this horrific pandemic, we were very limited in what we knew about the virus and the tools that we had available to keep people healthy, safe, and informed. We've ramped up our public health resources to the point where we're now outperforming most other states in the country. Our testing capacity has greatly improved overall and has climbed to unprecedented levels. In May, our 7-day average of total tests was around 15,000 tests a day. Now we've been averaging steadily around 55,000 tests a day for the past couple of weeks. And as of this week, as I said previously, we're the #1 state in the country in terms of testing per capita. And our average turnaround for tests continues to be under 2 days. We've extended free testing for all residents in 18 of the hardest hit communities in the Commonwealth, so-called high-risk communities, through the end of October. Contact tracing remains an important part of our public health response, and between our local health departments and the Community Tracing Collaborative, there are about 1,900 people conducting tracing programs here in Massachusetts on a daily basis. Contact tracers are now able to reach out to almost every confirmed case within 24 hours of being notified of a positive test, most within 2 hours, and they're able to reach most contacts within 48 hours. In the last 2 months, the Community Tracing Collaborative increased its staff to support colleges and universities as students return to school. And we've used many of these resources to not only contain the virus, but also to carefully reopen the Commonwealth since May. Based on the current public health metrics, today, I did sign an executive order that will allow lower risk communities to advance to step 2 of the 3rd phase of the Commonwealth's reopening. Lower risk communities are the gray, green, and yellow towns on the weekly COVID-19 risk map, provided that they've been lower risk for 3 consecutive reporting periods. Step 2 opens up a limited set of industries, certain types of indoor recreation that have not previously been permitted to operate since we announced the original emergency order back in March. We've learned a lot through our own tracing efforts and by watching other states who were hard hit by COVID early on as well. And we've seen that the activities we're moving forward with today have not led to significant transmission in other states. It's important to remember that today's order applies only to lower risk communities. Communities that have been designated as high risk or red in any of the 3 most recent weekly DPH reports are not permitted to move forward in the reopening process until the data indicates it is safe to do so. Please keep in mind that this list will be updated tomorrow on Wednesday when we update the COVID-19 map. Most businesses have been open for a few months now, and the data makes clear that people have been acting responsibly in most circumstances. Today's order addresses indoor performance venues and indoor recreational facilities like laser tag. It does not address large venues like stadiums and arenas. This order goes into effect about a week from now on Monday, October 5th. We're also making minor changes for lower risk communities to the protocols that have been in place for other sectors. Lieutenant Governor Polito will share more details, but this includes some increases for capacity limits for places like gyms, museums, and libraries. Again, we've learned a lot from watching what's going on in other states, especially in the Northeast region, and similar changes elsewhere have not led to significant transmission there. Our administration will also update the gathering limits for low-risk communities in some outdoor settings. The indoor gathering limit remains at 25 for people here in the Commonwealth of Mass. The outdoor limit will increase to 100 people in public spaces and regular event venues for lower-risk communities. In the higher-risk communities, the limit will remain at 50 people for outdoor events. Lieutenant Governor Polito will provide more details about Step 2 in a second. While we're moving forward with this step in lower risk communities, the fight is far from over. We all know the virus will be with us until there are treatments or a vaccine, and as we've seen in other states, it doesn't take much for it to spread quickly when people let down their guard. As I said earlier, we're only able to gradually reopen the economy, get kids back to school, give people a chance to work when our residents work hard to be safe and healthy every day. Individuals and families need to keep wearing face coverings, avoiding large gatherings, staying home, especially when they feel sick, and following the guidance and the advisories that have been put out by Department of Public Health and by local boards. We're grateful to those local boards who work tirelessly to make their communities safer and healthier. And generally speaking, everyone here in the Commonwealth has been doing their part. But it's quite possible that Massachusetts may see more cases as people head indoors in the fall, and especially as we continue to expand our testing protocols. And that is one of the main reasons why we cannot quit and should not quit now. We've proven we can contain this virus. We've proven we can reopen our economy, but people need to stay vigilant so that we can continue to move forward. And if we all do our part, we can live, work, go to school, and live safely. And with that, I'll turn it over to the Lieutenant Governor.
Good afternoon. Thank you, Governor. The last 6 months have been challenging for everyone across our Commonwealth, but especially for the many businesses in downtowns and on our main streets. As the Governor said, we have all worked together to fight this disease and have been able to see good progress by working together, but COVID-19 remains with us. As we carefully and gradually reopen more of the economy, it is important that businesses and customers remain safe and continue to follow appropriate guidance and protocols. Today, Governor Baker is signing an executive order authorizing Phase 3, Step 2 for lower-risk communities. Effective Monday, October 5th, lower-risk communities will be permitted to move into Phase 3, Step 2 of the reopening plan. Higher-risk communities will not move to this phase and will remain in Phase 3, Step 1. Lower-risk communities are communities that have not been a red community in any of the last 3 weekly DPH reports. To continue as a Step 2 community, a lower-risk community needs to continue its positive metrics. If a community becomes red, again for 3 consecutive reports, it will have to move back to Phase 3, Step 1, and remain there until public health data indicates it has returned to a lower risk level for 3 consecutive reports. Phase 3, Step 2 of the reopening plan impacts a small list of businesses, as the Governor indicated. Only a handful of new sectors are permitted to start opening with restrictions. This step includes guidance for indoor and outdoor performance venues, indoor and outdoor recreational businesses, like trampoline parks, laser tag, and roller rinks. More specifically, indoor performance venues will be permitted to open with 50% capacity with a maximum of 250 people. Performers are excluded from that capacity number. Outdoor performance venue capacity will increase to 50% with a max of 250 people. For arcades and indoor and outdoor recreation businesses, additional Step 2 activities like trampolines, obstacle courses, roller rinks, and laser tag will also be permitted to open, and capacity will increase to 50%. Fitting rooms will be permitted to open in all types of retail stores. Gyms, museums, libraries, and driving and flight schools will also be permitted to increase their capacity to 50%. We are also making a number of updates to protocols for other industry-specific guidance for a range of Phase 1, 2, and 3 businesses, which will be posted throughout this week and in advance of the October 5th effective date. Lower-risk communities are permitted to move to this phase due to our public health data. And some of these changes also align Massachusetts more closely with permitted activities in surrounding states. Governor Baker also mentioned gathering limits. Today, we're issuing a revised gatherings order, which permits some increased gathering sizes only for lower risk communities. The limit for indoor gatherings will remain at 25 people for all communities. The limit for outdoor gatherings at private residences and in private backyards will be 50 people for all communities. Outdoor gatherings at event venues and in public settings will have a limit of 50 people for higher risk communities. For lower risk communities permitted to move to Phase 3, Step 2 only, outdoor gatherings at event venues and in public settings will increase to a limit of 100 people. It is important that we reopen our economy and support our local businesses, but as we've said before, this virus is still with us. As we adapt and learn to live with COVID-19, and until there is a vaccine or a medical breakthrough, we must all continue to do our part to fight the disease. Again, I just want to thank the business community for their hard work over these past months, and we're pleased to see this next step of Phase 3 open for lower risk communities. I'd like to now turn it over to Secretary Setters.
Governor, Lieutenant Governor, Secretary Keneally, good afternoon, everyone. To follow up on the Governor's comments, the reporting of testing data has continued to evolve since the beginning of the pandemic. As he said, more than 2 million, in fact 2.2 million individuals have been tested and 3.9 million tests administered. We will and do report daily, in fact it's on page 8 of the dashboard, the percent positivity of tested individuals as well as for all molecular tests. For yesterday, the percent positive for new individuals tested was 2.4%, and for all molecular tests was 0.9. Testing is one piece of a layered strategy of mitigating and containing COVID until such time as there is a safe, effective, and available vaccine. The others include vigilance, monitoring, contact tracing, and responding quickly in response to community-level issues. We have the resources and capacity to respond. It is also why we implemented the Community Enforcement and Intervention Team for our persistently high-risk communities. Our team is very active and engaged with these municipal leaders and their teams, especially important as we head into the fall and winter. These communities include Chelsea, Everett, Lawrence, Lynn, Revere, and Framingham. Working closely with municipal leadership, local mayors, public health officers, and police chiefs, this collaborative effort is focusing on enforcement, such as ensuring gatherings in homes and at public settings remain small and within the required guidance limits. Over the past 5 weeks, ABC and DPL have visited or inspected unannounced 5,400 places of businesses. Enforcement operations were conducted in 75 municipalities, where an estimated 950 licensed establishments were checked. Nearly all were found to be in compliance. CEIT also is focused on enhanced public messaging to combat COVID fatigue and raise awareness of the risks that still exist. Over the past 5 weeks, our public awareness campaign has yielded more than 10 million impressions through advertising and other communication means in these persistently high communities. This will continue to grow as our paid campaign expands. These impressions are high quality, direct conversations via telephone town hall, reverse 911 messages, and thousands of personal interactions with field teams, boots on the ground. The field teams have handed out 64,000 flyers, 17,000 masks, and 10,000 hand sanitizer bottles, all in these highest risk communities. Cities are building on our field teams by hiring additional city-supported ambassadors and organizing Spanish language radio interviews with their multilingual police officers. Since we started our community level reporting, Chelsea has come down from 32 incidents per 100,000 residents to 22. Lynn has come down from 23 per 100,000 to 11. To continue building on this progress, we have extended our Stop the Spread free testing initiative through the end of October. We have provided more than 237,000 tests at multiple locations in 18 communities. As the governor said, the average testing turnaround time in Massachusetts is 1.8 days, a measure that has continuously declined as we've worked with our labs and providers to prioritize this and minimize the use of out-of-state labs. And if you feel sick, get tested. Our contact tracing network is also well positioned heading into the fall and winter. Since April 10th, 175,000 people have been contacted by contact tracers, and as you heard from the governor, we have 100% capacity to perform contact tracing as reported on national websites. And as some of you may remember, at the beginning of the pandemic, residents didn't always answer their phone when a tracer called. Now, in part due to our public awareness campaigns in multiple languages, more than 92% of cases are reached. We have also announced a new grant program to help prevent and reduce the spread of COVID in communities of color. Faith-based and community organizations in high-risk communities can apply for grants that will range from $10,000 to $50,000. Recent reports, we know, indicate that infection and death rates are disproportionately high among communities of color. These funds can be used to raise awareness around best practices, help to connect families and individuals, to be safe and stop the spread. I know, we all know, COVID fatigue is real, but we must remain vigilant. Protect yourself and others. Wear a mask, wash your hands often, and keep 6 feet from others whenever possible. Thank you. Secretary Keneally?
Great. Thank you, Governor, Lieutenant Governor, Secretary Sutters. There's no question the past 6 months have been tough on everyone. Today's announcement acknowledges the hard work that everybody has put into protecting the public's health, minimizing virus transmission, and finding ways to get as many people safely back to work as possible. We've made clear progress, and today we're asking everyone to please keep it up. To the business community, especially our retail stores and restaurants, thank you for following the standards and protocols put in place to protect your workers, customers, and vendors, and please continue to do so. To residents, please continue to wear face coverings, maintain social distance, limit the size of gatherings, and engage in frequent hand washing. Continue to shop and dine. Our main streets need you now more than ever, but remember to do your part to make those visits as safe as possible. The steps announced today are the result of momentum we've built together over the last 6 months. Having now entered the fall season, the weather will present new challenges, especially for outdoor dining, and we've been pleased to support innovative downtown upgrades through a number of state programs. But the standards and protocols will be even more important as we move indoors. Throughout the pandemic, we've complemented federal aid with our own efforts to make loans to small businesses, micro enterprises, and low and moderate income entrepreneurs as a way to sustain those key areas. At the end of August, we launched the My Local MA campaign to encourage people to travel, shop, and dine within Massachusetts, as the campaign says, to put your money where your heart is. Making adjustments to combat the virus has taken a commitment from everyone unlike anything we've seen before, and we need that same commitment to support our main streets and downtowns. Thank you to everyone for your vigilance that has gotten us to today's announcement. This is a major milestone, and we welcome the new opportunities available as well as new responsibilities. Let's do our best to ensure that this progress continues as our world-leading institutions, scientists, and researchers work toward a medical breakthrough to defeat the virus.
Questions on this?
Governor, the percentage of positive, of individuals whose tests come back positive is up. We talked with an expert yesterday who's urging caution, and we just heard you say, you know, as we head indoors, the cases are likely to rise. So instead of moving to the next phase, should you be pumping the brakes a little on that?
Well, first of all, we continue to test at national leading levels, and by testing aggressively with our college community, we get to identify positive cases, isolate and quarantine where appropriate, and trace, so that we don't end up with some of the significant outbreaks, really significant outbreaks people have seen in other parts of the country. The whole point behind the Stop the Spread program, which is a huge piece of our testing initiative here in the Commonwealth, is it 18 or 13 communities? 18 communities which have been persistently high risk have basically unfettered access to free testing. And that means we find cases, because those are communities in which we know there's high risk for COVID and transmission. By finding those cases and helping people isolate and doing the tracing associated with that, again, it's a way to contain and limit the spread. And as Secretary Sutters pointed out, a number of the communities who are part of that have seen significant improvements in their cases per 100,000 since this program began. Salem, for example, was at either 11 or 12 when this began 4 or 5 weeks ago, and they're now green. They're below 4. Many other communities have also moved out of red into yellow during that period of time as well. But at the same time, we still have a Commonwealth where hundreds of communities, based on what is becoming months of testing, simply don't have significant community transmission. And in those communities, we believe, based on conversations we've had with governors and public health officials in other states that are like ours, that these are perfectly appropriate things for us to support with guidance, okay, because they've been doing it in many cases for months at this point and don't believe these are sources of significant transmission in their states.
Even as we enter the fall, even as we head into the fall and colder weather, more people head indoors.
You know, what has been particularly interesting about the summer is very, very few examples of significant spread have occurred in organized, structured, rule-based settings. Most of our new cases, most of our clusters have involved unstructured, non-rule-based gatherings that have taken, celebrations, parties that have taken place between and among people where there aren't any rules. Part of what I think we're trying to do here is recognize and understand that in many states, an emphasis on organized gatherings, organized play, organized indoor activity has actually not translated in those places into a significant increase in cases, but exactly the opposite. And these governors would say the same thing you'd hear from me, the opposite, the unsupervised, the unorganized, the familiar being familiar, as I've said before, is really where the greatest risk is. So if people are going to go inside, which they probably will, I would much rather have them go inside in organized and supervised ways with rules than in unorganized, unsupervised ways with no rules.
Governor, can you talk about the strategy behind this initiative, where is the low risk being rewarded and then the high risk being inspired to do better? Is there kind of, what's the philosophy of the mindset?
I think it's more about just taking the data as it sits and as it stands and acting accordingly. As I said, many of our conversations with governors in other states that look like us and have similar population density and similar size have said that many of the elements that we're talking about today are things that have been open and operating in their states for a while without any significant impact on transmission. At the same time, we do have a lot of communities in Massachusetts that haven't seen a heck of a lot of COVID for quite a while, and giving these communities the ability, with rules and guidance, to do some of the things that have proven to be safe in these other states just seems like an appropriate step. And as I said before, I would rather have folks, if they're going to go indoors in places with rules and organization and supervision than go indoors in places without any.
But do you think the state is providing
Worry about the perception, though, if people think like they just get a pat on the head because they're doing better? I mean, has that been thought about?
The whole Stop the Spread program is basically only available to communities that have high risk, okay? So to some extent, I think what we would say is we're trying to create frameworks here that work for people in Massachusetts based in part on where they live. If you look at the reason we put together 3 approaches to school reopenings, remote, hybrid, and and in person. The whole goal behind that, when Commissioner Riley and his folks worked that one out with the pediatric community and folks in the public health community, was based on this idea that different communities would probably be in different places over the course of the year, and they should be able to have a plan that they could refer to that was consistent with whatever their state of play was at that time.
Governor, a lot of these providing a false sense of security by highlighting this lower positive test rate with all the repeat tests of the college students instead of the percentage of individuals.
You know, this is certainly a debatable question, but the way I think about it, there are a lot of people who travel, and there are a lot of people who work in places that are, you know, considered to be places if you go to, under our rules, you got to come back and either quarantine or get a test. And we have a lot of repeat testers in our data, many of whom are repeating for work-related reasons. And as the Secretary said, and as I said, we have 3.9 million tests. We have 2.2 million people who've been tested. The college community was viewed by all of us, I think, over the course of the summer as a potentially really high-risk community, all right? Which is why we spent so much time with the Broad Institute and with a sort of college advisory group putting together protocols for testing on a frequent basis at an affordable price with a quick turnaround at colleges here in the Commonwealth. And that's exactly what they're doing. My view would be every time somebody tests negative, they tested negative, whether it's a repeat test or not. It's still part of the universe of data and information that's available to us that tells us about what's going on with respect to a particular community, the Stop the Spread communities, the gray and green communities, or the college community, which I think of as a community where we should test regularly. And I've talked to college presidents who've said to me that the fact that these kids know they get tested every 2 days, actually, or twice a week, or whatever the rules are, it does have an impact on the way they think about the decisions that they make, and that's a good thing. The other thing I would say is if you take the higher ed stuff out, our positive test rate over the course of the past 30 days is 1.7%, which is still consistent with where it's been throughout the course of the summer.
Governor, with laser tag and trampolines being allowed.
Juxtaposition. People open up the newspaper today, they're reading epidemiologists saying they're seeing a disturbing trend in Massachusetts. One says, I'm worried about Massachusetts. The same day you come out and say, hey, let's move forward with the reopening for certain communities.
In lower risk communities, structured, organized, with rules. Yeah.
That's the way you square that?
Yeah.
Governor, laser tag and
indoor performance venues opening with 50% capacity, maximum people, limit for indoor gatherings and capacity. 5.
You're talking way too fast. I can't understand you.
The limit for indoor performance venues is raised at 50%, the maximum 250 people.
Yep.
The limit for indoor gatherings is raised to 25 people. How does the science say it's okay to have 250 people in a performance venue, but not okay to say have like 30 people in a different type of location? How do you square that?
Well, keep in mind that the gathering rule has to do with anything that doesn't have sector-specific guidance. And that was the difference. I mean, if you think about a restaurant, right? Our rules around restaurants are restaurant-specific, and they don't have a percent issue attached to them. They have a distance issue attached to them. So there are a lot of gatherings that take place, and some of them people would call sort of organized, but they're informal. A wedding in a backyard, for example. Anything that's a gathering of more than a certain number of people that's not attached to a specific set of guidance, where we can put real criteria in place that we expect people to follow through on, execute on, and can be inspected on. That's a different kind of gathering than one that involves something like a performance theater, where the rules are really clear and very specific about what it is they can do.
Governor, students in
Yeah, we're still talking to the multi-state folks, but in the short term, our focus was really on the PCR program we were developing with the Broad for 2 reasons. One, PCR testing is generally considered to be sort of the gold standard, for lack of a better word. Antigen tests are absolutely helpful and appropriate in many cases, but under CDC guidance and the guidance here in Massachusetts, if you get a negative antigen test, you still have to get a PCR test to confirm that in fact you are not contagious, that you don't have COVID. So our focus was really on ramping up in the short term the Broad Institute, where they're now doing 40, 50,000. They can do up to 50,000. They're probably doing 25 or 30, aren't they? They can do more than that? Up to 100. So our focus was really there. On the first question, the one about the call with the White House yesterday with the governors, spent a lot of time on this issue. And this is the Binax test, which was developed by Abbott, which is has a very high score for both sensitivity and specificity, like really high, north of 95%, I think, for both, which is really unusual for that type of a test. It uses a card, a swipe on a card, as opposed to a traditional testing machine to actually determine the outcome of the test, and it basically clears in about 15 minutes. It still has to be administered by a trained professional, okay? I think most states, and I would include Massachusetts in this category, are probably going to try to use these as they become available to support our K through 12 schools. We think in many respects this could be a really terrific tool for school nurses and local boards of health and public health departments as they deal with the issues associated with hybrid learning and in-person learning. I don't really know how it would help in a remote situation because you're not really dealing with the sort of coming together that we talk about when we talk about hybrid and in person. The rollout here is basically based on your size as a state. So we have basically 7 million people, so 7 million of whatever the current count across the country is, which I'm assuming is somewhere around 350. We would get 8% based on our size. And that would be true for every state. And it's going to come on kind of a rolling basis. You're not going to get it all at once. It's going to come as they become available through the manufacturing process. So the way to think about it is we'll probably start getting an allotment next week. And then, there'll be allotments to come after that. And our goal will be to work with the folks at DESE and with the folks in K through 12 to make sure that the communities that are in person and hybrid have access to these tests so they can make them part of their strategy along with our mobile testing capacity that we made available to them.
Could I ask Secretary Sutter something about the data?
Yeah.
Sorry.
Well, you don't like my answers?
I think I got one more, so I'm looking for a little more. Secretary Sutter, so these epidemiologists that say there are troubling trends, is it to Massachusetts we're dealing with here? Like certain communities are doing so well, but others are going in the wrong direction, and is the Stop the Spread program working if we're seeing increasing numbers in some of the red areas?
Well, I think as the governor said, one of the reasons, however many weeks ago we started putting out municipal data was to see the impact of COVID across 351 communities and towns for us to then really stratify what our interactions were going to be with those municipalities. So Stop the Spread, I think it actually is quite effective. I think the numbers I cited for Lynn, which was 23 per 100,000 and is now at 11 per 100,000, that is, again, a multi-layered approach of testing, tracing, supporting, public messaging, and the like, and you see the difference in 6 weeks. Chelsea, for example, which was also on a upward trajectory, right, has come down a little bit, not as much as we've seen in Lynn, for example. So yes, when you make barrier-free testing available, it is, 237,000 tests, I think I said 238,000 tests have been available for individuals, but that's just one strategy. The other thing we've done, and you may have seen in the press this week, is when there is a community identifies what they think is a cluster or clustering development. We saw it in Haverhill recently, Dedham, not terribly long ago, Melrose, around, as the governor would say, informal football gathering coming together, and we were contacted and we were able to provide mobile testing. So it's not stop the spread, it's a very focused 5-7 days. We did it in Salem, very successful, right? Salem went from whatever I don't actually remember what their...
11 down to 3.
Right, there you go, 11 down to 3.5, so we can then target an interaction with that community. So yes, what we're trying to do is very much now tailor, right? We set up testing. We have 257 some odd testing sites across the Commonwealth of Massachusetts, and now really target stop the spread in the persistently high communities, and then mobile testing when we think that there is a response that's needed quickly, in addition to all the things we're doing in congregate care, nursing homes, and the like, which is an ongoing support function. And to just, we are excited about the potential of the Abbott Bionex in Massachusetts. There are some other logistics we have to work through. All sites have to be CLIO waivered. It does require nurses or other kinds of technicians who are trained, and there has to be a standing order, and obviously if it's kids, would require the permission of parents in order to do the tests. But it is an exciting, potentially exciting development in Massachusetts.
Secretary, I have a question as well regarding COVID-19 data specifically. I was wondering, looking at the Chapter 93 data, I still see some either low numbers or gaps in occupation, primary language, disability as far as COVID cases go. I was wondering what the holdup is, if there's still issues getting labs to communicate that information to the state
When that legislation was enacted, it was enacted with an emergency preamble. That emergency preamble means that the law immediately goes into effect. And when that bill was in conference, we had a lot of interaction with the conference committee and other key legislators about the fact if it was enacted with a preamble, the Commonwealth would be unable to immediately comply with the provisions, because it requires both technological and systems changes in order to gather the information. And the governor was faced with signing the legislation, which had a very important piece in it, which was the creation of the Health Equity Commission. So to sign it, he could have sent it back with an amendment, or he could have vetoed it. We signed it with a clear understanding that we were unable to immediately comply, and it would take up to 3 to 4 months for us to put the systems in place to provide all the data elements that the legislature has requested. We've actually, if you've looked at the data, we continue to increase the data fields that we're getting reported on, and we will continue to comply with it. But anyone who's ever been involved with system changes, you can't just immediately put into place the systems and technology upgrades you need. And in fact, when the governor signed that legislation, he immediately he sent a piece of legislation asking for specific amendments to that law so that we could have, in fact, complied much faster.
One other thing I'd say about this is the legislation puts the onus on us, right? There's no onus on the folks who give us the data other than to de-license them. So, which is sort of the nuclear bomb for, right, so doesn't even have that. So one of the things we said in the legislation we filed, which we would love to get, was that there's an onus, which we can use fines for, which is a much more effective tool to get the folks who actually have to give us the data to actually give us the data.
Anything to add
Bruce?
to the
Governor, it seems to be a change in terminology about your map. When it started up, you talked about high risk, moderate risk, and low risk. Now everything is low risk, so high risk. Why the change?
Because there's a bunch of bouncing back and forth between green and yellow for most of the communities that were green and yellow. One nursing home outbreak, one football party, one thing, because you're going basically from 4 to 8. From under 4 to over 4. Takes you from green to yellow.
You also go the other way.
Pardon me?
You also go the other way from above 8 into between 4
Yeah.
and 8. Boston is at 7.9 right
Well, Boston's biggest issue is the colleges, right? They are gonna have, because of the testing regimen in Boston, and because it's so aggressive, Boston is going to end up with a bunch of college kids who are probably going to tip them into red. The mayor said this last week. That's a completely reasonable prediction, given the number of college kids who are in the city, how often they're being tested, and the practical reality of what that will look like. Now, the big challenge for Boston, and this is not just a Boston issue, it's an issue in some of the other communities that bang around from one level to another, is if you have a college, if you have a hospital, the Brigham is probably going to have an impact on Boston's numbers this week too. If you have a number of institutions that have an outbreak of some sort, it will hit your numbers in the short term, and the real question is what happens over time. And the thing about communities that are persistently in high-risk category, one of the things you can draw from that is that isn't about, the hospital. It's not about the nursing home. It's not about the big party that somebody had. It's not about the big gathering that took place. It means there's something more going on, which is why the Stop the Spread program and the community intervention efforts follow it, because the goal there is to then do what we can to help those communities start to work their way back. And we have had several that were persistently red either go to yellow or go all the way to green. And some will be harder than others for a whole bunch of reasons. But the bottom line is most of those communities are pretty engaged in trying to get from here to there.
Anything to add about the charges at the Holyoke Soldiers' Home as the board gets ready to meet over Walsh's fate?
Well, I mean, I've said before that I've said that what happened at Holyoke was a calamity, and that Mark Perlstein's report was almost impossible to read in one sitting. And in the 80 or so conversations that I had over the course of 20 hours with family members who lost somebody during that outbreak, it was brought home to me in the most graphic and painful way possible, how something that was so good became literally a nightmare. And I said last week when I got asked about this that I expect the board, when they meet, to finish the job on removing Bennett Walsh. And I hope they do that.
Can I ask you a quick follow-up on my question, Governor? Are you worried at all about cross-pollination from green to red? Because of course, or red to green, a family in Lawrence can pack up and go to Andover to the roller rink, or someone in Lincoln can go to Swampscott. I mean, are you concerned about that at all?
So, I mean, people still move around, right? But if you go to a roller rink, that roller rink has rules, and that roller rink has guidance, and that roller rink has protocols in place, and everybody's going to be expected to follow them. And they're designed to do one thing, which is to keep people safe and limit the spread between and among the people who are there. I would much rather have that family do that than go participate in a big backyard barbecue with no masks, no social distancing, shared food off a buffet, and all the stuff that time and time again is what's translating into clusters and case run-ups here in the Commonwealth.
And 20 BU students were caught and they face suspension
Yeah.
hearings now after having a big party. I wonder if you think they should be suspended, and if you think we're asking too much of college students right now.
I don't know the facts in the BU case. I'm glad that there will be a hearing and this will be discussed in an appropriate way by the people at the school. I think the statement that Northeastern made earlier this year was a pretty loud and an affirmative one about how they were going to treat this and how they were going to deal with it. Yes, we are definitely asking more of our college students, but I would argue we're asking more of pretty much everybody. I mean, think about the parents who testified this morning on Zoom before the Joint Committee on Education here in Massachusetts, who talked about how difficult it is for them to get their kids the kind of traditional, in-person, 6 hours a day, every day education that they got before COVID. Think about all the issues. I mean, there is practically no one outside of maybe, you know, Zoom, Amazon, and WebEx for whom this whole thing hasn't been, in some particular way, really harsh and has asked more of people than they were asked of before. And, you know, but that is the way and the world in which we live in right now. And I'm glad that our colleges and universities spent the time, many of them, trying to figure out how to bring kids back. I'm glad we spent hours and hours with the folks at the Broad trying to figure out how to create what most of those college presidents are now telling me is the most accessible, fastest turnaround, cheapest testing protocol and processing system in the country. So the kids could get tested, faculty could get tested, staff could get tested on a pretty regular basis. It's not pleasant in many cases, it's not pretty, but it's part of the world in which we live. And as we've said many times in this room, it's going to be like this until we have treatments and vaccines. And the more we can create structure and guidance and rules and processes in place that have been proven to be effective and safe for people to do things and to encourage people to do those sorts of things instead of the things that don't have any rules or process or social distancing or face coverings or oversight, that's better than the opposite. Thanks, everybody.
Your thoughts from tonight?
Prosecution of two individuals that hold down.
I'm not the law enforcement folks. That's the role of the Attorney General and the U.S. Attorney. I know the U.S. Attorney is also pursuing the possibility of doing something here. What I would say is that the Pearlstein report raised time and time again errors and mistakes that had huge consequences for the people, horrible, huge consequences for the people who live there. And you spend enough time talking to a lot of the families who are involved in that, and it becomes clear just how huge and horrible those consequences really were. Thanks.